the South African public healthcare system has been under tremendous strain in the last couple of years. This has prompted a local NPO, in other words, a non-profit organization. It's called Mobile Health Clinics, to take its model to schools in disadvantaged communities in Gauteng. Now, the clinics will provide free primary healthcare services to learners. Let's get more information now on this initiative, and we're joined by the founding member of the Mobile Health Clinics, Dr. Rosy Ndhlovu, who talks to us from the Northwest Province this morning. Good morning to you, Dr. Ndhlovu. Tell us first what made it, why it is that you started this initiative. What sparked the interest, or perhaps what some people would refer to as something of an activist role by yourself in order to help those who are less privileged?
Thank you, Xoli, and good morning. Good morning to you and the viewers today. Mobile Health Clinics Foundation was founded on the principle that children's future, children's well-being is what makes up our future. And so our tagline is their health, our future, which is the basis on which Mobile Health Clinics Foundation was founded. We firmly believe that if children stay in school, if children are thriving in school, they are able to do well, they are able to see through their school career and eventually become contributing, thriving members of society. And that was the basis on which the principles of the Mobile Health Clinics Foundation was founded.
Yeah.
Furthermore, the WHO, which is the World Health Organization, has long identified the link between health and education, and therefore identified learners and students being in school as an ideal space and opportunity for well-being and health to be provided to children. And so that is what drives us. That is what the foundation was founded upon.
Yeah. In the era of pit toilets, and I'm not going to try and exaggerate, Dr. Ndhlovu, but every now and then you hear of a story of a child who's fallen into a pit toilet and they lose their lives because of that. Talk to us about the solutions that your initiative is bringing about in order to curb this.
So one of the core components of any school health program is health education and health promotion. We're also very happy that the sponsor for this particular program in Gauteng, which is Bayer, wanted to focus specifically on sanitation and water as one of the key education modules to provide to school children. And so in these health promotion talks that are done by our health coaches, who are part of the team that provides these health services in schools, we conduct talks to children about how to be safe as well as healthy. And so in the context that you're referring to, one of the key messages that goes out to children is the importance of having someone walk along with them, so that if anything happens, someone is able to sound an early alarm. But most importantly, just how to manage that situation. It is unfortunate, and it is one of the things that from an infrastructure perspective still needs to be attended to. And we, from a health perspective, provide health education and health talks just to give children guidance as to how to manage these kind of situations and how to sound early alarms if this unfortunate instances do happen.
Yeah. The other area of importance when it comes to educating children in the primary schooling phase is that of early pregnancy. Is that something that you also are prioritizing? Because oftentimes that's where stigma comes in, and that's where children who have unfortunately had to bear children whilst they are children themselves, they get ostracized, and sometimes that child falls off the education system. Is that part and parcel of what you do?
So, providing age-appropriate sexual and reproductive health care is definitely part of the school health program and the school health curriculum. And this, as I indicated, is provided in an age-appropriate context. So it's mostly for children in what is defined as the senior phase of schooling, which is the latter grades. So there's a curriculum that educates young girls and boys about responsible sexual behavior, and also encourages girls who unfortunately do bear the brunt of having to be the ones that make the choices to go to a clinic or to a health facility to access family planning methods. And so that education is definitely provided in an age-appropriate context.
Yeah.
Part and parcel of what we are actively working on is also a module that empowers young girls. As you say, sometimes it is either difficult to access the solutions that you require, the contraceptives that you may require, or just information. And then if you do find yourself in that situation, it is also, as you mentioned, very difficult to then go back to school and continue your learning curriculum. But it's part of the ways in which we are aiming to empower young girls. Even in that situation, they should endeavor to go back to school. And how do we then strengthen their resolve to complete their education?
Yeah.
And so part of what we are doing is having workshops with girls to just try and understand what are the challenges that they face, and how can we prepare an education and empowering and supporting package as part of our mental well-being module to try and address some of these issues and just give them the strength to see through their school career.
Yeah, and the kind of impact you're making?
The impact we're making is really, really positive. So far, nationally, we are a national NPO, and so we've managed to visit over 103 schools over the past 3 years that we've been operating. And we've managed to see almost 60,000 young learners, which means that when you roll up the total number of services that we provide in primary health care, in oral health care, in vision care, and providing free glasses to those that can't see, and dental interactions, when you count up all of those different interactions, we've provided well over 500,000, that's 500,000 services to all the various schools that we've attended. So we're having an impact. We obviously want to have a greater impact, and so our aim is to service or to provide the screening to 1 million learners. And just to give you context, there are almost 10 million learners in public schools in South Africa. So our aim or goal for 1 million learners is just part of it. I think we're part of the solution, but not the whole of it.
Founding member of the Mobile Health Clinics, Dr. Rosy Ndhlovu, thank you very much for your time and indeed the impact you are making in these disadvantaged communities.